Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain hypocalcemia and its relation to eyes, as connections between ophthalmology and endocrinology. The endocrinology is a study involving hormones of the human body. A lot of the hormones in our system affect not locally but through the means of the bloodstream many organs spontaneously. Parathyroid hormone is one of those hormones and is part of the strict controlling mechanism of the calcium level in the blood. Therefore, systemic disorders affecting the parathyroid hormone and the calcium level can also affect the eyes as well. The definition of hypocalcemia is the corrected blood calcium concentration of less than 2.12 millimoles per liter. I say corrected because for every decrease in albumin from 40 by 10 grams per liter, we should add 0.2 to the calcium level for corrected concentration. This is because the part of the total calcium in the blood is the calcium bound to albumin. If the albumin level itself drops, then the total calcium level will drop as well. So the corrected concentration is calculating for ideal carrier protein concentration. Hypocalcemia is uncommon overall, but this is something we should not miss. The causes of low PTH can be multifold. PTH, by the way, is a hormone that serves to increase the level of calcium in the blood and decrease the level of phosphate in contrast. If there's low PTH, the likely scenario, if other controlling mechanisms for calcium is also deficient, calcium level in the blood will be low as well. The low PTH is likely due to hypoparathyroidism because the parathyroid gland produces PTH. The congenital factors that lead to hypoparathyroidism is a mutation in the calcium stimulating receptor of the parathyroid gland. This could also be caused from DiGeorge syndrome, where the characteristic feature in a child is the lack of a thymus gland. The acquired causes of hypoparathyroidism is post-operative neck surgery and an autoimmune condition called autoimmune polyendocrinopathy. Type 1 of this condition can lead to hypoparathyroid, Addison's disease, and mucocutaneous candidiasis, a fungal syndrome. The low calcidiol, which is one of the precursors for calcitriol from the kidneys, can result in low calcitriol and therefore less of an absorption of calcium and phosphate from the GI tract. This can lead to malabsorption, or rather from malabsorption or short GI tract, liver disease, and increased vitamin D degradation. Because vitamin D is an important building block of calcidiol, and anticonvulsants can deplete calcidiol as well. If there is normal level of calcidiol, other causes of low levels of calcium include chronic liver failure and hyperphosphatemia, because if there's high level of phosphate in the blood, more PTH will be produced to eliminate the phosphate, but the excess phosphate will bind with the calcium to precipitate it out of the blood. So hyperphosphatemia can be caused by tumor lysis because the cell's main fuel source is ATP, and ATP has a lot of phosphate. So breaking down of cells will release a lot of phosphate from inside the cells. rhabdomyolysis occurs with the same phenomenon. The muscle fibers break apart, releasing large amounts of phosphate. And from exogenous source, if there's oral phosphate abuse, such as laxative intake, can cause hyperphosphatemia. Symptoms and signs of hypocalcemia include the central nervous system, the cardiac system, and the bones. In the central nervous system, there is neuromuscular excitability that's affected. The perioral area, the location around your mouth, becomes numb. There's peripheral paresthesia, the tingling sensation, and tetany, which includes Schwostek sign, Trousseau sign, and laryngospasm. Schwostek sign is where the facial muscles contract when the facial nerve anterior, right in front of the ear, is stimulated in the ipsilateral side. This occurs because of the hyperexcitability of the facial nerve. Trousseau sign. Positive Trousseau sign can be observed when placing the blood pressure cuff on the arm for around 3 minutes. This sign can be observed in the hands and feet, known as carpopedal spasms, where there is involuntary muscle contractions in the extremities. Laryngospasm is the muscle spasm of the vocal cords. Another signs that could be dangerous in a cranial central nerve system is seizures, due to the increased excitability of the nerve fibers. Rarely, basal ganglia can have some calcifications from imaging, and movement disorders may be identified. In the heart, ventricular arrhythmias can be observed from hypocalcemia, and in bones, growth plate abnormalities known as rickets can be a developmental signs with chronic hypocalcemia. Goals of therapy includes restoring normal levels of phosphate and ensuring no instances of hypercalciuria or high levels of calcium in the urine. And instead of reestablishing normal levels of calcium, because it could go into hypercalcemia, our goal is just to get calcium level just below the lower limit of normal. And regular and frequent follow-up is needed for the rest of the patient's life. For less severe and acute or just chronic presentations of hypocalcemia, oral calcium can be taken with meals in an amount approximately 1 to 3 grams once to 3 times a day. Calcitriol, which is a hormone that's normally produced in the kidneys and helps with the absorption of both calcium and phosphate, can be taken up to 3 times a day with a dosage of 0.25 to 0.5 micrograms. In acute and severe cases, it will be very important to make sure and perform the ABCs and ensure IV access, and administer IV calcium gluconate. We're going to do that with 2 to 3 amps or grams over 20 minutes. And sometimes direct infusion of calcium through IV may be needed. In terms of the anatomy of the eyes, the lens is located right behind the pupils and the iris. It is held by the zonular fibers that connect it to the ciliary muscles. The ciliary muscles can adjust the shape of the lens to accommodate for near distance viewing. The optic nerve is the collection of axons from the ganglion cells throughout the retinal layer and they converge at the optic disc. They then form the optic nerve and exit through the posterior side of the eyes. Largely, the calcium is very tightly controlled with 3 hormones as a controlling mechanism. The parathyroid hormone plays a major role by releasing the calcium from the bone reservoir and also activating the kidney transport system to release phosphate from the blood. Calcitriol is a hormone released from the kidneys, and they act to increase the GI absorption rate of both calcium and phosphate. Calcitonin plays a minor role in this control mechanism and works to deposit the calcium in the blood onto the bones. The risk factors for hypocalcemic eye abnormalities include living in a geographical area with low level of sunlight. Because the skin has the enzymes to convert precursors to vitamin D, not enough sunlight can cause vitamin D deficiency. Addison's disease, or primary adrenal insufficiency, and IBD, short gut syndrome, can all cause hypocalcemic eye abnormalities. Liver disease, because the liver is an important part in the synthesis pathway of calcitriol, and primary familial hypomagnesemia is a rare but a pertinent cause of hypocalcemia and related eye abnormalities. So what are some symptoms of hypocalcemic eye abnormalities? One is subcapsular cataracts with decreased visual acuity. Cataracts are opacification of the lens due to alterations of proteins making up the lens, and this leads to abnormal refraction of the incoming light. Therefore, the lights don't converge properly onto the corresponding areas of the retina and may scatter within the eye instead. The signs of hypocalcemic eye abnormalities include papilledema, or swelling of the optic disc due to increased intracranial pressure. This can further lead to the inflammation of the optic nerve, or optic neuritis. The differential diagnosis of this set of presentation may be a rare form of retinitis pigmentosa. It can also be pseudopapilledema, where one or more optic discs are elevated without the edema of the RNFL. Diabetic papillopathy can also give off a similar appearance to hypocalcemic eye abnormalities. History and physical exams with patients with hypocalcemia and eye-related changes includes very thorough ophthalmic history, noting any visual changes, and past use or current use of glasses and contact lens, past ocular surgeries and LASIK, as well as family history of eye problems. On the slit lamp, you would examine the lens for any subcapsular cataract. You can also perform a fundoscopy with paying close attention to the optic disc on both eyes. Investigations include a thorough CEC and lights to look for any unbalance of electrolytes, check PTH, as well as calcium and phosphate. In terms of eyes, OCT can be run for optic disc elevation or edema. And lastly, check urine calcium to see if it's elevated. The treatment of hypocalcemic eye abnormalities includes treating the underlying cause or by restoring calcium and phosphate levels. The low vision consultation may be important because cataract is one of the results from hypocalcemia, and cataract surgery for subcapsular cataracts can be considered if the presentation is severe. So this is a comprehensive flowchart of the summary of entire presentation. And here's the reference from which we got all the information for hypocalcemia and the related eye disorders. Thank you for watching this video.